Um,
Yes.
yes, what is the topic, sir? Meera Kumari is going to present a topic on psychosocial aspects of alcoholism. Right, sir?
Yes, yes, yes.
Yes. So,
No,
I invite,
this
yes,
is been covered. The second topic.
Sorry, Meera, you are not audible to us.
sorry.
Sir, actually, the topic which you are trying to say is already covered. Sir,
Covered by whom?
the intoxicating link, alcohol and street crime.
It is okay, actually. Are you ready to present paper now?
Yes, sir. Sure, sir.
Then you can start your presentation. We are already late.
Okay, sir. Thank you, sir. Good afternoon,
Yes.
sir, to everyone
Yes.
present here. So, my topic is the intoxicating link, alcohol and street crime. So, I would like to start with the introduction. Sir, as everyone knows, alcohol consumption is a well-established
Meera, are
risk.
you presenting?
Are you using any PPT?
Sir, actually, I'm running short of time and my device battery is also low and I have to go somewhere. So,
Okay, okay. So please go.
At least use
Meera,
your
you
what
can go,
is a
please. Don't mind.
video.
Please,
At
okay,
least
please
sir.
you
go,
Thank you.
use.
Meera.
Okay, sir. So, beginning with introduction. So, alcohol consumption is a well-established risk factor for violent crime. And my paper just
Meera,
aims to say, yes, sir.
please stop.
Okay, sir.
We cannot allow you to present like this. You are running short of time. You don't have any presentation with you. You don't have phoning battery and all. So please go and do your other required things. Forget about the presentation. It is not a joke. It is a academic research forum where you have to maintain certain things, right? Sorry, I cannot allow you to present. Even the chairpersons are allowing you. I cannot allow you to present in this manner. Please stop the presenting and leave the session.
Okay, sir.
Yes, sir. I agree with you, sir. So I think Vidhi is now available, sir. So we can request Vidhi to make
Yes,
her
please.
presentation. Vidhi, are
Please.
you ready?
Good afternoon, sir. I have
Yes.
sent my PPT to the team. If they are ready with my PPT, they are ready to share, I can start.
Yes. I'll share with you. I'll share your PPT.
Yes, Athav, please.
Yes.
Thank you so much.
So I would like to introduce Vidhi, sir. Vidhi, she is a psychiatric social worker, tutor in CIP Ranchi. And her topic of the presentation is effectiveness of self-compassion based expressive writing intervention in obsessive compulsive disorder. So it is a comparative study. So with this, I request Vidhi to make her presentation. Thank you.
Yeah, thank you so much, sir. As sir has already introduced my topic, it is still I would like to say it again: effectiveness of self-compassion based expressive writing intervention in the OCD patients. It is a comparative study. Can we have the next slide, please? Okay, so introducing the word OCD. It is a debilitating mental health condition characterized by obsessions and compulsions. So if we talk about the obsessions, it is uncontrollable, intrusive, recurring, and ego-destroying troublesome thoughts, whereas compulsions are restoring to repetitive behavior to smoother those thoughts. If we talk about OCD, it is affecting 1 to 3% of the global population, and heterogeneous condition arising out of complex interplays of genetic and environmental risk factor. If we talk about the treatment procedure, we have pharmacotherapy as well as psychotherapy. However, OCD often takes up a chronic and debilitating course, posing challenges in mainstream treatment. So self-compassion is an important catalyst for providing mental health. Next slide, please. Okay. So introduction, lack of self-compassion we talk about, and deficit in emotional regulation. Now, reducing self-compassion and emotional regulation difficulties like linked with escalation of OC symptoms and poor prognosis. Addressing self-compassion can have a beneficial impact on the emotional regulation and can provide promising result in OCD. Adding self-compassion based therapy with existing treatment regime can hasten the prognosis. Next slide, please. Talking about the self-compassion based writing intervention as I have used, it is developed and tested for the first time as an augmented therapy by Pennebaker and Billing. This approach deals with following essential elements, which is self-kindness, common humanity, and mindfulness. Self-kindness is extending kindness and understanding to oneself rather than harsh judgment and self-criticism. Wherein common humanity, we see one's experience as a part of larger human experience instead of separated and isolation phenomenon. In mindfulness, it is holding one's pain, thoughts and feelings in a balanced awareness instead of over-identification. In OCD, all three components are adversely affected, as we have commonly seen so. So this approach was a thought as add-on therapy. Now, my aim is to evaluate the efficacy of self-compassion based expressive writing intervention and adjustment treatment in OCD patients. Whereas the objectives are evaluating the clinical efficacy of self-compassion based expressive writing treatment in reducing symptoms of obsessive compulsive disorder, whereas evaluating the degree of improvement in the self-esteem, quality of life, self-efficacy, and subjective well-being of individual with OCD. The material and method used are: the place of the study was outpatient department of Central Institute of Psychiatry, Ranchi. The study design was interventional OPD-based follow-up. Study was done at the hospital. Follow-up was conducted every 4 weeks, that is 1 month after the intervention. Sampling, if we talk about, there were 20 individuals with OCD purposively selected as participants, equally distributed in experimental and control group based using the random allocation method. We have selected the patient after they have been diagnosed by the after seeing the ICD criteria. Setting of the intervention conducted in individual setting. Experimental group received a self-compassion based expressive writing intervention with treatment as usual. Treatment as usual, we didn't touch their pharmacotherapy, neither the psychotherapy, which was going on like CBT. In control group, they received only treatment as usual. The assessment was conducted at baseline and again after 4 weeks. Each subject in the experimental group was asked 4 times to perform the task. Each session lasted about 30 to 45 minutes. Can we have the next slide, please? The outcome variables and measures were: clinical outcomes were severity of psychopathology of OCD through iBox, depression, Hamilton Depression Rating Scale, anxiety, we applied Hamilton Anxiety Rating Scale, and for non-clinical outcomes, self-compassion compassion level, quality of life, self-well-being, self-efficacy, and self-esteem skills were used. Next slide, please. Yeah, measures used for data collection were written consent form, social demographic and clinical data sheet, Yale-Brown obsessive compulsive scale, the self-compassion scale, which was of short form, WHO quality of life brief, which was in Hindi, satisfaction with life scale, general self-efficacy scale, the Rosenberg self-esteem scale, Hamilton Depression Rating Scale, Hamilton Anxiety Scale, and structured writing sheet were given to the patients, which I have already told about. We address mindfulness, common humanity, and self-kindness. The procedure were as shown on the screen, the baseline and the post-intervention after 4 weeks. These were the scales I applied. Statistical analysis. The statistical package I used, ISPSW version 25. Descriptive and interference statisticals were applied. Chi-squared tests were applied. Why non-pharmacological tests were used in the current study? I have mentioned that the underlying data do not meet any assumptions about the population sample. Distribution was normal. The population sample size was too small. You can take the study as a preliminary one, like that is why even the sample size was so small. Reasons for using Wilcoxon sign rank test were the Wilcoxon sign test is non-parametric counterpart of the paired sample t-test. Parametric paired sample t-test could not be used in the dataset because of skewed distribution and small sample size. See the impact of the intervention. Here, self-compassion based writing before and after design, Wilcoxon was used. This test is particularly used when dealing with ranked or ordinal data, making it an excellent alternative for analyzing repeated measures or paired observation in case of skewed distribution. The results were, you can see the table. Yes, you can see this. They were comparable, significant differences. I'm just showing the because of the. Only showing the two results. The result salient features were results suggested that the experimental group of OCD patient received self-compassion based writing therapy in addition to treatment as usual. Henceforth, the another group patient received treatment as usual. I can skip to the next slide. Were adequately comparable to each other were significant socio-demographic and clinical variables. An experimental group reported significant reduction in OCD psychopathology, then of OCD control group, which is Vibox score. Experimental group also reported significant reduction in concomitant depression and anxiety, where we use HAM-D and HAM-A scores. In case of outcome variable, self-compassion, experiment group had higher self-compassion level. Quality of life, significant increase in the quality of life of experiment group. Subjective well-being, significant increase in the quality of life of experiment group used, Wilcoxon sign rank test we used. In general self-efficacy, the experimental group also reports significant increase in the perceived general efficacy through the statistical test used, Wilcoxon. Discussion. The clinical efficacy of self-compassion based writing therapy was seen. Significant decrease in OCD through Vibox scores might be attributed to the ability of this approach in increasing skill in facing and processing traumatic experience more rapidly in OCD patients. Aligned with some past observations, the clinical efficacy of self-compassion based writing therapy was usually seen in the term of significant decrease in depression level in the experimental group through the HAM-D scores. Might be attributed to positive impact on an area, mindfulness, self-compassion, functional value, self-efficacy, and self-belief. With some previous studies, which I have already quoted, experimental group had significant increase in quality of life assessing institute. Improving in quality of life might be due to reduction in troublesome obsessive compulsive symptoms and reduction in contaminant depressive effects in cognition. Similar observation were noted in the study I'm quoting, and beneficial impact of this intervention by uplifting their self-compassion mindfulness and self-understandability might have helped them to have better control over their psychopathology and to deal with the adversities. Here are references I am quoting in the next slide. Thank you. That was from my side. Thank you so much.
Yes, thank you, Vidhi, for presenting this paper and finished it in time. And with
Can
this,
I
I
stop
request.
sharing my
Yes,
screen?
yes, you can.
Oops.
If there is any questions and if there is any questions or clarification, you can ask to Vidhi. Any questions?
Yeah, Vidhi, was a good presentation. Vidhi, I just want to ask the point which you have mentioned in your presentation that you have used emotional regulation techniques. So,
Yes,
what were
ma'am.
the techniques used by you during your interaction with the beneficiaries or with the important stakeholders?
Ma'am, usually when I gave them diaries for writing, I just gave them self-compassion break and exploring self-compassion through writing, along with that writing intervention. I gave them instructions with the breaking of time, and I didn't stress them. You just go and write. It was a 13 minutes. Sometimes it for few patients they could only write for 20-25 minutes. So with that breaks and self compassion uh, uh, writing,
Okay.
expressive writing, we did it.
Any other method we used by you apart from writing? Because there are other methods like mindfulness,
Yes,
listening to music, going for a
yeah,
walk, for
yes,
physical
ma'am.
exercise.
Yes, I just
Yes,
practiced
sure.
not more than deep breathing exercises, because already
Mm-hmm.
most of them were we didn't treatment use as usual was not touched. Like I didn't interfered in the therapies and the psychotherapies and pharmacological things. That is why I didn't did
Mm-hmm.
much on that.
Okay, good. Thank you.
Thank you.
Any other questions from the participants? No, if there is no question, then we can move to next presentation. Who is the next presenter? I think Chetan is there. Chetan, are you ready for the presentation? Chetan Sharma, or not Sharma? I think Chetan Kumar.
Yes, sir. I'm ready, sir.
Can I mute myself, sir?
Yes.
Thank you so much.
Chetan, okay, Vidhi. Thank you for your presentation. Okay. Chetan he is doing MSW in Delhi School of Social Work. He is in second year, I think, and currently he is doing MSW internship in Central Institute of Psychiatry, CIP Ranchi, and here he is going to make presentation on I think role of families in mental health. So what is the topic? Yeah, family as a mental health champion plays a vital role. So
Yes.
under the guidance of Dr. Narendra Kumar Singh sir, who is a senior psychiatric social welfare officer in Central Institute of Psychiatry. So I welcome yes, Chetan to make his presentation. Thank you.
Sir, is it visible, my presentation?
Yes, your slide is visible. Yeah.
Okay. Good afternoon, everyone. I'm Chetan Kumar from Delhi School of Social Work, and I'm MA second year student. And I'm here to present my presentation on the topic named Family as a Mental Health Champion Plays a Vital Role. So, first of all, introduction. Introducing it, families are essential for maintaining mental health because they offer a sense of belonging, practical help, and emotional stability. Their participation can have a big impact on well-being and healing of those dealing with mental health issues. Further, to know the role of importance of family in mental health, we can a model named biopsychosocial model. So in this model, it is given by American psychiatrist George Angel. So this model says, in order to analyze a illness or health, especially in psychiatry, it is any illness is a result of interaction between biological, psychological, and social factors. To be specific with the psychological factors, we can see that family circumstances, family relationships are the key factors which results to the mental health. So moving ahead, my research problem is to understand how family act as a mental health champion, identify the types of support provided by families and challenges they faced. The methodology used by me is a qualitative approach. I have done the case studies and some of the observations from my fieldwork to gather the data. My study has focused on the experiences of families, highlighting the importance of family in mental health outcomes. Moving ahead, after doing the case studies, I have found that by the active involvement of families in these aspects of treatment, mental health became more effective, leading to better outcomes. The aspects such as collaboration with healthcare providers. Under this, participation active participation, providing inputs on patient history, behavioral patterns leads to more effective treatment. Secondly, family therapy and counseling participation, engaging in sessions supporting therapy goals at home by the families, it is more beneficial. Likewise, medication management, reporting the side effects uh, of the patients, assisting in medical adherence, communicating the changes with the healthcare providers are moving to next. Provide emotional and practical support. Next, supportive home environment, recognizing and reporting. Under this, we can see the family members can recognize these early symptoms as early as possible and report to the healthcare providers. That leads to proper treatment of the patient. Promoting open communication within the family members, it leads to a supportive environment for the patient. Social integration. Under this, it is very difficult for the patient to get reintroduced with the community. So the family members rebuild the relationship and interaction with the community. Moving ahead, communication bridge. The family act as a communication bridge between the patient and the healthcare providers. So, and family oriented approach. The family have a family recovery oriented approach by having a positive mindset. So that this aspect also helps in the involvement of treatment. Moving ahead, the challenges faced by these families, which I found, are stigma and misunderstanding. Under this, discrimination from the community, misconceptions leads to isolation of the patient, leading to reluctance to seek to help from the healthcare providers. Secondly, balance and personal well-being. Under this, by the caregivers who are at the home, who are giving the care to the patient, they face challenging by keeping their own needs and at the same time balancing their own needs with the caregiving to the patient. Emotional burden. It becomes an emotional burden as constant worry and stress, feeling of grief and helplessness is a kind of emotional burden for the caregivers. Lack of knowledge and skill. They usually lack in understanding of the illness and how to manage the symptoms. Then financial strain. As we know that the mental health is a long process, long treatment process that leads to financial strain. Also the medicines are of high cost that also lead to financial strains. Thirdly, family dynamics. Due to unequal distribution of caregiving within the family members, the family relationship within the members becomes under a strain. Thirdly, treatment adherence. Providing time to time medication, regular medication, it is a kind of challenge for the caregivers. Thirdly, navigating healthcare system, future care management, and secondary trauma. Under secondary trauma, it can be seen that in the process of providing the care to the patient, the family members also experience a kind of trauma-like symptoms. That also becomes a kind of challenge. Moving ahead, I have found that these role of psychiatric social worker with the families promote the families involvement in the treatment, such as assessment. In the assessment, the social worker does the family assessment, try to find out the potential issues of the trauma of the patient. Secondly, supporting the families. They offer individual and family counselings, help to adjust the changes, provide emotional supports. Thirdly, providing resource and guidance. A psychiatric social worker connects the families with the community resources, the appropriate NGOs who can further support the patient. Education and information, providing information, education of treatment option, coping as strategies. then advocacy. A social worker can do advocate for the rights of the patient. It can they can also liaison between the family and the healthcare providers. Skill, skills and trainings. Under skills and trainings, as we know that under the occupational therapy, a psychiatric social worker can refer a patient to the occupational therapy so that he can acquire some good skills and which will help him out to come out from the trauma. Care and coordination, ensuring the continuity of care during the transition period is also a work of psychiatric social worker, providing legal and ethical support. Under this, letting know the family members and the patient about the patient's right and the ethical approach with the patient is the work of psychiatric social worker. And at last, I would like to conclude that families are essential in promoting mental health. Engages families in mental health care leads to better outcomes. Continued education, support, and collaboration with professionals are vital in making families effective mental health champions. Thank you. This is my presentation. Thank you.
Thank you, Chetan, for your presentation and also completing your presentation within time also. And this is a very important topic. You have covered almost all the areas, such as the importance of family in the treatment and then the what kind of problems that they are facing as a family member, as a caregiver, the kind of problems that they are facing, and
Yes, sir.
finally, the role of psychiatric social worker. So what we can do as a psychiatric social worker to help the family to come
Yes,
out of their problem or to reduce their what caregiver and to the quality of life you have covered. So if there is
yes, sir.
any questions from the so you can ask a question to Chetan.
No question in chat box and no one raising his hand and all. We are in meeting mode anyway. Whomsoever want, they can ask a question.
This is very important topic actually. Without the involvement of family, it is very difficult to treat the patient, especially the caregivers of patients with severe mental illness. The family's involvement is very important. At the same time, the family caregivers of patients with a severe mental illness, they tend to have a lot of psychosocial issues, that is
Yes, sir.
caregiver burden. So all those things actually, it is very important. So we as a psychiatric social worker, generally we focus on the patients many times, not only the psychiatric social worker, even the other mental health professionals also. We work with the patients and we forget the families, what kind of problems that they are undergoing. Some of the
Yes, sir.
times because of their excessive caregiver burden, they may develop even say some kind of depression also. If it is not very severe depression, and mild level of depression is very common. So to address this issue, the social worker should focus not only on the patient but also on the family caregivers, right?
Yes, sir.
To help them to ventilate their feeling or to help them to provide supportive psychoeducation, supportive counseling. So all those things are very important. If there is no questions, so we can stop here. Thank you, Chetan, for this wonderful presentation. And you have
Thank you.
covered almost all the areas. So
Thank you very much.
move on to the next presentation.
Thank you. Thank you.
One question have come. If
Okay,
Chetan
sir.
can take it up.
Yes, sir.
How to apply? I think this is related to methodology.
Yes, sir.
But the question is not very clear. How to apply the methodology? If they can further elaborate, then the Chetan will be able to answer this question.
Definitely, sir.
The question it has come from Rajeshwar P.
Senthil sir,
Yes, sir.
if
Yes, sir.
I may intervene. Actually, we are
Yes,
running
sir. Yes, sir.
behind the schedule. We
Okay,
are
sir.
running
Okay, sir.
behind the schedule, and hence the question is not clear. So just
Okay, sir.
call
Okay.
the
Okay.
next presentation.
Yes, sir.
Thank you,
Yes, sir.
sir.
Yes. So who is the next presenter? Because we have a list. In that list, some of the presenters they have already presented. I checked with them. So anyone is left now? Because sir, Pupender sir, I personally spoke to the presenter, and they said actually they have presented already this paper.
All right. So, Meera, are you
I
ready
think
with
the
your
session is over.
slides?
Who, sir?
Meera,
Who is
she
presenting?
was having some
Oh,
difficulty with her slides, so I'm just asking whether she want
okay.
to. She's not here, I think. Anyway, okay.
I
Now,
think now the session is over, sir. Yes, sir. And over to you, sir.
no, I was telling that hence we don't have any presentation. Then you can take that question which you was about to take from the audience. I was
Yes,
presuming that we have
Chetan,
3 more
no?
presentations.
Yeah, Chetan. Yes, Chetan, if you can
Yes.
answer this question. Yes.
May I audible, sir?
Yes, you are.
Yes, Rajeshwar
Yes.
ji, you are audible.
Sir, I am asking that this methodology apply, no, sir. How to apply? How to be considered that one methodology? I want to just explain. Sir.
Yeah, I think it is not original research. Yeah, I think better this Chetan can explain. As what kind of methodology that you have used here. Yeah, I
Yes,
think
sir.
this paper it has come from your experience, right? Working with the patient
Yes, sir.
while doing your internship.
Yes,
Yeah.
sir.
So over to you.
So currently I'm doing my internship at Central Institute of Psychiatric, Ranchi. So in that I got the opportunities to talk to the families of the patient. So suppose that I asked some non-structured, I did non-structured interview. I questioned them and tried to analyze their situation, and I asked that how they got benefits from the social worker, psychiatric social worker. So this was my, and likewise I talked to 2 to 3 families.
Chetan, did you seek permission from the institute where you are pursuing this research? Whether
Yes,
the staff is beneficial for the patient and the family members or not? In case by any mistake, if your research findings are against the institution, you would be in a trouble because you don't have ethical permission to conduct such kind of a study. Did you seek
With
any permission from CIP?
with the permission of chairperson, I would like to add something here.
Sir,
yes, sir.
please.
Yes, sir. You can.
Yes. So, Chetan is missing a lot of thing in methodology. This is not original paper. It is based on secondary data. He has
Yes,
gone different family therapy book and journals where he found 2 and 3 cases related to role of family in mental illness. Based on their secondary data, he is compiled all the challenges, all the environment, and all the role of security social work. So he missed out in methodology part to share with you all. So I think this was the not original work, and this was based on secondary data. He went the different journals and go through find the 2 and 3 cases. Based on their cases, he write a paper and present it to all of you in front of you. So this is the way he did the do the work and present it to you, all of you, in front of you. So I if yes,
yes,
this
sir.
is this is the way you have did the paper, I think, Chetan.
Yes, sir. I did review literature also, sir.
Okay.
Yes, thematical paper in the same person that said yes, written that whether it is a thematical paper, I think it is a thematic paper. I hope it has answered the question. Yes. Any other questions?
if I may get a
And
chance to ask a question from the previous presentee, do we have?
yes. I
Actually,
think Vidhi is there, and it is also a wonderful research that she has done. It is a very
Vidhi.
unique research. Yes. Vidhi.
Hello.
Okay, Vidhi, actually, very wonderful presentation. We are running behind the schedule, so I decided not to ask or not to comment anything. So because I am going to ask, so it is my responsibility to consider that your paper was very good. And while you was presenting, I was thinking that this paper deserved to be presented in the award category rather to be presented in
Yes,
Definitely, sir.
definitely, sir. Even before, even I also told her the same thing only. It is a original research, and you have done a unique research, which is not. It is a routine research which we do in our clinical practice. I think she has missed the opportunity. She could have
yes, sir.
presented in the.
I just want to say, sir, thank you so much, Sanjay sir, for
But
adding that. I really
Vidhi,
wanted to present in award category, but I'm just not having membership and many other things are there. I just missed the opportunity. Actually, even this I submitted on the last day with giving extra money. So definitely next time I will try to keep it in award category with all my tables.
actually, my question is still waiting. It was just a complimentary part.
Sorry.
Coming to the another part. You first thing that it is a very good research and it was a original research. So, what is the ethical label or ethical status of your paper? Question 1. Question
Ethical
2.
status as in, sir?
Ethical status of your paper. Was that approved by CIP
yes,
ethics
sir.
committee,
Yes, sir.
committed by?
It is approved by ethical committee, and I have all my documents along with that, the letter from the ethical committee.
All right. Second question, that you had gone with the OCD, and OCD has been considered that one of the chronic illnesses. And
Yes, sir.
many times, if it is not with the good insight, then it can cause a very difficult condition for the family, for the patient itself. So, have you assessed the capacity of your patients or clients before conducting your research? Is there any difference between the level of capacity between your groups? Point
Sir,
one, yes, please.
sorry, sir. I just assess the ability of their reading and writing, like the minimum criteria of class 10th they have passed or not, and if they would be in the consent form. I very firstly I asked that if they are ready and they have to write a diary, whether they will be able to write it or not, whether they are ready for the experiment or not.
That is right. But as I am telling, that OCD is a condition where we cannot say surely that patient is having capacity to give you consent or not. So whether
Yes,
you used any methodology to ensuring the capacity of consent or not, this is just a question. Whether you used any methodology to ensure their capacity or not.
Sir, as such, I have used only while talking to them, not as such any during in the consent form. The domains were there. Other than that, I didn't apply any scale or something like that.
Okay, so just consider it as my suggestion that when we are planning to conduct a research on the mental illness conditions which are considered in the severe category, specifically that all four, those who are notified several times in several gadgets and the documents of our policy making and all, that need to be ensured the capacity of participants. So first you have to ensure that whether they have the capacity to give the consent or not, then you can proceed it.
Okay, sir.
But it was a very good presentation and the paper as well.
Thank you, sir. Thank you so much. I'll ensure to add it while moving forward with this paper.
Thank you, chairpersons, for permitting me.
It is one part of dissertation, her dissertation work. Hopefully, she can continue or present her remaining part in the upcoming conferences. Yes,
Right.
Thank you. Yes, sir. Thank you, sir. Thank you. And then I can also ask our co-chairperson, ma'am, whether she can comment anything.
Senthil sir.
Yes, Athavala, yeah.
Actually, one of our presentee, Miss Meera, has contacted me. So,
Okay.
are we taking her presentation or not?
No, Bhupender sir.
If she is fulfilling the criteria of the presentation, then
Okay.
I don't have any objection. But she was
shared-
asking to present without any PPT, and she was just trying to get excused. That was not acceptable.
Yes, she has shared the presentation with me. So I will present her PPT and she will present it.
Okay.
Okay.
Chairpersons can allow, please.
Okay, sir.
Yes, then if we have time, then we can allow her to make her presentations.
So it was our last session. Now, after that, we have to move to the valedictory. So you can allow, sir, no issue.
Yes, she can make
I was
presentation and
pushing,
Athavala
just
can help.
considering that 5 papers. I was pushing you people that I was thinking that we have
Yes,
5
yes.
papers in this same session.
Yes, sir. Yes, sir. Yes. So Meera can make her presentation now. So over to you, Meera. Are you there?
Sir, I have shared the Zoom link to her. She will soon join us. Meanwhile,
Okay.
I'm sharing her PPT.
Yes, yes, yes.
Yes, sir. Sir, may I start?
Yes. Meera, you can start your presentation. As we can see that Meera Kumari, she is a research scholar and she's doing a research. I think she's a research scholar, a PhD. Are you pursuing PhD, Meera?
Yes, sir.
Yes, I hope. Yes. In the Department of Sociology, Ranchi University, our topic of the presentation is the intoxicating link, alcohol and street crime. So with this, I invite Meera to make her presentation.
Sir, may I start now?
Yes, Meera, you can start.
So, sir, basically my topic is the intoxicating link, alcohol and street crime. Now I want to share my second introduction. Yes, sir. So, alcohol consumption is a well-established risk factor for violence, The paper aims to shed light on the neurocognitive link between drinking and violent behavior. The association between alcohol and violent crime is a significant public health concern, particularly among adolescents and young adults. Research suggests that alcohol disrupts brain functions critical for controlling impulses and regulating emotions, potentially leading to aggressive and violent behavior. The Global Burden of Diseases Study, GBD 2019, highlights the substantial burden of alcohol on adolescents, GBD 2019. Now, I would like to share my another, yes, methodology. This paper examines research findings on binge drinking and its association with violent crime, highlighting the potential consequences for predators. Furthermore, it analyzes the prevalence of alcohol-related crime within the prison population. The study relates into a specific case study, Ranchi, India, where data from the Central Institute of Psychiatry (CIP) showcases the high proportion of alcoholics among the patient. Now, sir, second result, alcohol acts as a disinhibitor, reducing self-control and lowering inhibitions. This can lead to individual engaging in risky behaviors they would not consider when sober. Impaired judgment further exacerbates the situation as individuals under the influence may struggle to assess situations accurately or respond appropriately. This altered decision-making process significantly increases the likelihood of resorting to violence, vandalism, or other criminal activities. Now, sir, conclusion. This research has investigated the relationship between alcohol intoxication and street violence by examining the disinhibiting effects of alcohol and its impact on judgment. The study establishes a clear link between excessive alcohol consumption and as increased risk of violent behavior and criminal activity. The prevalence of alcohol-related crime within the prison population further highlights the severity of this issue. Thank you, sir.
Thank you. Ramya. Question to your method that you have adapted. Yes, it is not very clear. So whether it is a single subject case
Sir,
study
can
or
you, sir, your
any other methodology you
audible,
have adapted.
sir. Voice is cracking.
No, I'm asking actually what kind of methodology that you have adapted in this study, whether it is a original research study or is a thematic paper. So kindly let us know or clarify. So what kind of methodology that you have adapted, the research methodology?
Yes, sir. Sure, sir. Sir, methodology is that it analyzes the prevalence of alcohol-related crime within the prison population, and it also studies into the specifically Ranchi. From the data come from Central Institute of Psychiatry (CIP), which is shown in the high proportion of alcoholics among the consumption alcohol in huge amount, and it's associated with violent crimes.
It's an open call. May I request others to mute themselves? Please. Professor Jethio, please mute yourself. Meera, please go ahead.
Okay, sir. Sir, so my paper is there on research findings on binge drinking and its connection with violent crimes, and it also analyzes the prevalence of alcohol related crime within the prison population, and it also delves into the specific case study Ranchi, India, where they, from the Central Institute of Psychiatry, CIP, which
What is the
showcase
sample size, Meera? What is the sample size?
30.
Okay. Those things are missing, and whether it is a purposive sampling or what kind of sampling method that you have used.
Purposely, sir.
Okay, okay. Okay. But in your slide, no, those things are really missing, that inclusion criteria, exclusion criteria. So methodology part, actually, it was missing. Okay, any other questions from the participants' side? If there is no question, I think one question is, yes. Oh, it is not a question. Okay, sir. So, Bhupinder, sir, from your side, if there is any questions and clarification from Meera.
No, sir. You
No.
can conclude
Okay.
from your
And
and another
I think
chairperson.
I can invite a co-chairperson, ma'am, also. We can give ma'am. We can invite ma'am. Are you there, ma'am?
Yes.
Yes,
No,
ma'am.
thank you
Your
so much.
comments, ma'am.
Yeah. No, my comments are like all the papers, they were very good, but I was expecting that some research, if the research can be done taking the primary data, because my subject is social work, and I like the research which are conducted at the field level. Meera, she presented her paper, but I guess the primary data was missing in her research. And the Chetan presentation was very good. And the Vidhi presentation on OCD and the right to intervention, it was very well presented. So congratulations to all the presenters, and thank you to you, sir, and Upender, sir, for giving this opportunity. Thank you.
Thank you,
Yes.
both the
Yes, sir.
chairpersons.
Thank you, sir. Yes, sir. Thank you, sir. Thank you.
Thank you, both the chairpersons and all the speakers of this session. So now we would just take a break for very brief break for few minutes, and would start our next program, that is valedictory function on this same platform.